And welcome back to Med School Radio. In this series, we are going to be reading MCQs for the GI system. So let's go ahead and get started. Let's begin with the first question. A 35-year-old alcoholic male is admitted for nausea, vomiting, and abdominal pain that radiates to the back. The laboratory value that suggests a poor prognosis in this patient is A. Elevated serum lipase, B. Elevated serum amylase, C. Leukocytosis of 20,000, D. Diastolic blood pressure greater than 90. So what do you think the answer is here? And the answer is C. Leukocytosis of 20,000. The ransom criteria are used to determine prognosis in acute pancreatitis. Factors that adversely affect survival include age greater than 55 years, leukocytosis greater than 16,000, glucose greater than 200, LDH greater than 400, and AST greater than 250 IUs. After the initial 48 hours, a fall in hematocrit, hypocalcemia, hypoxemia, an increase in BUN, and hypoalbuminemia are also poor prognostic factors. Hypotension with systolic blood pressure less than 90 is also a poor prognostic sign. And diastolic hypertension is not correlated with prognosis. Okay, let's look at the second question. A 50-year-old black male with a history of alcohol and tobacco abuse has complained of difficulty swallowing solid food for the past 2 months. More recently, swallowing foods has also become a problem. He has noted black, tarry stools on occasion. The patient has lost 10 pounds. Which of the following statements is correct? A. The patient's prognosis is good. B. Barium contrast study is indicated. C. The most likely diagnosis is peptic ulcer disease. Or D. The patient has achalasia. And the answer is B. Barium contrast study is indicated. The most likely diagnosis in this patient is esophageal carcinoma. Dysphagia is progressive, first for solids and then liquids. There is blood in the stool and a history of weight loss. Alcohol use and cigarette smoking are risk factors. Prognosis is not good, as once there is trouble swallowing, there is significant esophageal narrowing and the disease is usually incurable. A barium contrast study should demonstrate an esophageal carcinoma with marked narrowing and an irregular, ragged mucosal pattern. Formerly, squamous cell carcinoma accounted for 90% of esophageal cancer, but its incidence is decreasing. Now more than 50% are adenocarcinomas, most often associated with Barrett's esophagus. Achalasia should not cause goic-positive stools or progressive symptoms. So there we have it, the first 2 MCQs. So join me again for some more MCQs on the GI system.